Thank you all for coming today. I'm Congresswoman Diana DeGette from the 1st Congressional District of Colorado. You're standing in the heart of my district today. And I'm also the co-chair of the Pro-Choice Caucus in the U.S. House of Representatives, along with Congresswoman Barbara Lee from California. And obviously, the issue of reproductive health has become the top issue in this country right now, not just for the election, but really for public policy and affecting the ability and freedom of every single American to get the health care that they need, including abortion, not politicians in Washington deciding what's going to happen. Monday is the 2-year anniversary of the devastating Dobbs Supreme Court decision, and that decision has wrought nothing short of chaos and confusion in this country. After that decision happened 2 years ago, immediately laws either banning or severely restricting abortion in 21 states took effect because they had been enacted by far-right conservative legislatures, but they had not gone into effect because of the protections that Roe versus Wade gave to every American. Suddenly, Americans across the country were faced with severe restrictions on their health care. Everybody knows the stories, and the stories are shocking. There was a 10-year-old girl in Ohio who was raped and whose parents had to take her to another state to get the health care that she needed. The stories out of Texas continue to multiply because Texas has leaned in trying to punish people who need reproductive choice. And the one that strikes me the most is the woman who was carrying a baby and started to have a miscarriage. And she went to the emergency room where she was told that they couldn't perform the necessary abortion services to terminate the miscarriage. She would have to go home and get really, really sick. She did that. She had sepsis. She almost died. And now it's unlikely that she and her husband will ever be able to have another baby. This is what the Supreme Court wrought on the citizens of the United States. And this is what we're here to talk about today. Here in Colorado, abortion is still legal, and I want to thank the wonderful advocates who are standing around us today for making sure that everybody in Colorado can have the access to the health care that they need. This fall, we will have a ballot initiative to make sure that this right is enshrined in our Constitution. But we still need to do more to make sure that everybody, no matter their socioeconomic background or their race, can get the access that they need. But even with that going into effect, Colorado is an island in the West. And so what happens here in Colorado is that people from other states around us are forced to come here. Out-of-state patients in Colorado made up of almost 30% of the abortions that we had here in the last 2 years. What that means, aside from the terrible and unnecessary burden that these patients from other states and their families have had to bear, it also means that patients here in Colorado have had to wait for the services that they need that are legal here in Colorado for an unbelievable amount of time. And so, frankly, this situation is not getting any better. It's chaotic. It changes all the time. Look what happened a few weeks ago, where Arizona suddenly outlawed all abortions, and then under pressure from advocates, they allowed some more abortions, but it's still severely restricted. People don't know what medical services they can legally obtain, and frankly, they should be able to have all of the medical services that they need. In Congress, in the U.S. House of Representatives, the Republican Party has made restricting not just abortion, but birth control and in vitro fertilization a top priority of theirs. Now, I will say, because I'm co-chair of the Pro-Choice Caucus, I did a little research. 184 Republicans in the U.S. House of Representatives today have co-sponsored legislation that would outlaw abortion because it it identifies a fetus from the moment of conception as a person. So it would outlaw all abortions, irrespective of rape, incest, the life or health of the mother, or anything else. It would outlaw all in vitro fertilization, and it would outlaw many forms of birth control medication. This is an extreme position that over 180 Republicans have taken. They don't want to talk about it so much right now because they can read a poll, just like all the rest of us can read a poll, but they will work hard to enact a national abortion ban if Donald Trump is elected president and they keep control of the U.S. House of Representatives. So that's what I'm fighting against every single day. I'm fighting to let people know that the only solution to this is to pass a bill called the Women's Health Protection Act, which will make Roe versus Wade the law of the land, so that a person in Colorado can get the same healthcare services as a person in Wyoming or Texas or California or Florida. It's the United States of America, folks, and we should all have the freedom to use our healthcare as much as we want. President Biden and our next speaker, Secretary Xavier Becerra, have been working hard to make sure that we do whatever we can to give the right to birth control, to IVF, and to abortion access to every single American. I was proud to serve with Xavier Becerra when he was in the U.S. House of Representatives, and I saw what a fierce fighter he was for women, for families, and for health care. I'm so honored that he has joined us here in recognition of this anniversary and in commitment of our continued fight going forward to ensure everybody gets the health care that they need. Secretary Becerra.
Thank you. First, Congresswoman, to get to you and to many of your colleagues who for years have been making this fight well before Roe v. Wade was overturned, well before women had to worry about traveling outside of their community, outside of their state, to just access the health care they needed, well before. And so it is simply expected that someone like Diana DeGette is going to stand up at this most crucial time. So Congresswoman, thank you to you for your leadership and for inviting me to come to Denver and to Colorado to talk to people of like mind who are trying to make sure that healthcare is there for everyone. We are on our Reproductive Health for All tour, but I could simply have called this Health for All tour, because reproductive health is important to everyone. And Congresswoman, you made it very clear. In vitro fertilization is important to the spouses who are trying to have a child, not just to the woman who might not be able to bear, or the husband who might not be able to provide sperm that's active. It is important that we recognize that healthcare is at stake here today. 2 years ago, the Supreme Court struck down 50 years of rights, of protections. And the consequence wasn't just a consequence on abortion. It was a consequence on access to care. And so what we're talking about today, what we fight for today, and what we're fortunate to have here in Colorado today is access to healthcare. But it should be accessible everywhere. Why is it that reports are telling us that more than 170,000 women have had to travel outside of their community, outside of their state, simply to get the health care they need? Why is it that women aren't sure what their rights really are, even in states like Colorado? Why is it that the privacy of that woman as a patient, the privacy of the physician who provides that woman with care, should be in jeopardy? We're fighting for the right, the freedom to be able to make decisions about ourselves and our bodies. And we are fighting to maintain that autonomy that Americans treasure, the civil liberties, the individual freedoms that have made this country strong, because we respect each other as much as we're a collective. We still recognize the right of individuals to be whole and to protect them as they make decisions about what's best for them. This tour is about making sure no one is confused. This tour is about making sure you know what your rights are. This tour is about making sure no one deprives you of your right to get the health care you need. And this tour is about making sure if you can't get the care you need where you live, we're going to help you find it so you don't go without. There have been too many cases where the outcome has been, well, as Congresswoman DeGette said, near fatal. And we know that in states that restrict access to reproductive health care, if you're a woman, you're 2 or 3 times more likely to die if you're going through pregnancy. That is not right. Final thought. My 3 daughters still are trying to grapple with the fact that they have fewer rights today in America to access the health care they need than their mother did. And their mother is an OBGYN, a high-risk OBGYN. And it's interesting, she often would tell me, Javier, as important as it is to understand abortion and why it's so important to protect it, people don't recognize an abortion is a safer procedure than the delivery of a baby is. You are likely to suffer more consequences if you go full term with a pregnancy than if you have an abortion. An abortion is safer than delivering a baby. Yet there are people who would try to deny a woman whatever care she needs most. We can't tolerate that. We have to live with the laws that we have, because we respect our institutions, but we can fight to make them better. And that's what this country's about. That's what this tour is about. And that's why it's so important to come to Colorado. Colorado gets it. And we need to make sure that everyone around the country recognizes that, like in Colorado, we're going to respect people's right to access the care that they need and make sure they have the information that they need. And I am thrilled that joining with us today is the Lieutenant Governor of this great state. I want to make sure that I thank her and Governor Polis for the work that they're doing. Let me now turn it over to Lieutenant Governor Diane Primavera.
Good morning, everyone, and thank you to Secretary Becerra for joining us in Colorado on his Reproductive Health for All tour, and also to Representative Dinah DeGette for hosting us today, and to the providers and advocates who are here as steadfast partners in our continued fight for reproductive freedom. As Colorado's Lieutenant Governor, I affirm that abortion is health care, and every person in Colorado has the right to decide if, when, and how to start a family. Colorado's support access to more freedom. I also stand here as a woman, a single mom, a grandmother, an individual that's been diagnosed with cancer on 4 separate occasions. I, just like any other patient, bring my own life experience when I meet with my doctor, and I can't be defined by a list of medications and procedures. That's why it's essential that we honor the humanity and the autonomy of patients and protect the decisions that they make with their providers. Reproductive freedoms for Americans are being attacked from all sides, but Colorado is standing up for bodily autonomy. I'm proud to say that in spring of 2022, Governor Polis signed the Reproductive Health Equity Act, HB 22-1279, declaring that everyone in Colorado has the right to make their own reproductive choices. In 2023, we strengthened Coloradoans' reproductive rights in partnership with many of you in the room by signing additional bills into law, including, first of all, ensuring that healthcare professionals are safe to provide legal healthcare services, expanding access to reproductive healthcare services in both commercial insurance and Medicaid. Governor Polis is a member of the Reproductive Freedom Alliance, a nonpartisan coalition of 23 governors, the largest such coalition ever convened, and I'm a member of the Reproductive Freedom Coalition, a caucus of 22 lieutenant governors led by Connecticut Lieutenant Governor Susan Weissowitz, and together we reiterate to Coloradoans that reproductive health care remains safe and accessible in our state. We know Colorado providers and advocates are busier than ever, and this isn't easy work. To our providers here, thank you for your incredible resilience and compassion. To our advocates here, thank you for championing the needs of Coloradoans and their families as attacks continue to be thrown our way. So any steps we can take to prioritize health and freedom in Colorado are essential, and I'm grateful to join you in this crucial work. And now I'd like to introduce Dusty Gurulé, President and CEO of Color and Color Action Fund.
Good morning, everyone, and thank you all. It's so amazing to be here with all of you. So Color is a 26-year-old organization. We have been working since then, since we were founded in '98, to ensure that Latino community, Latinas, have a voice in the policymaking table. And as we've continued to grow, we continue to build. And always front and center for all the work that we do is our community, right? And so we know that Colorado is, we're in a good place, right? It's legal, abortion is legal here, but I would argue it's not completely accessible. We still have deserts, healthcare deserts throughout the state. There are a lot of hundreds of thousands of people who are not able to access abortion care because of their state-funded insurance. But we're going to change that on November 5th, when everyone here votes yes on Initiative 89. The number may change, but you'll hear from us when it does change. Because for us, it's not just about legality, it's about accessibility. Free of stigma also, like that is so critical and so important. And I think the more that we talk about the importance of healthcare, right? It is healthcare, and instead of having to sort of put us in a different bucket, people who have a uterus put our healthcare in a different bucket. That's not okay. That's not okay, and frankly, I'm over it. And so, you know, I think the work that we've done with Cobalt, Karen and I actually are co-chairs for the campaign for the Coloradans for Reproductive Freedom. And we also co-led the Reproductive Health Equity Act, because we know that we have to continue building and pushing even our friends sometimes to come with us in the fold, right, for this continued expansion and protection of our community, because we know our community wants this. We know our community supports this ballot measure. We test in the Colorado Latino Policy Agenda that 62% of Latinos in Colorado will support this ballot measure. We're all doing continued polling, and we know, and it's not just about abortion care. Like, we want to make sure that our community is taken care of, and expanding on our work with the state Medicaid office to continue expanding care for people regardless of documentation status, because we can't just focus on people who have papers. And so the more that we do together, the more that we push the envelope, the better we all will be. And hopefully it spreads to our neighboring states. But Colorado is always at the forefront, and I'm proud that we will continue to be. So thank you all. And again, thank you, Congresswoman DeGette and Secretary Becerra and Lieutenant Governor.
Yeah, I think
Oh, and I need to introduce my co-chair for the Coloradans for Protecting Freedom, Karen Middleton with Cobalt. Thank you.
Thank you so much, Dusty. Thank you so much to the Secretary for making Colorado a priority on the Reproductive Healthcare for All tour. I am Karen Middleton, President at Cobalt. You know, it's been almost 2 years since the Dobbs decision, and even though it was expected, please remember that it was a gut punch. It really impacted so many people. I can't tell you how many people came up to me and said, I never believed we would be here. And so a lot of people were really, truly unprepared for that loss of rights. Rights that so many of us grew up with were simply gone. My daughter has fewer rights than I did, echoing the Secretary's remarks. And there are people all over the country who are saying that. Here in Colorado, as was said, we had put into place the Reproductive Health Equity Act. It is only in statute, so that protection is only as good as the next election, which is why we're striving together to make sure that we enshrine this right in the Constitution so that it is not subject to the whims of term limits and state legislative control. We've also enacted the SHIELD law, and I can't tell you again how important that is, because we have people calling us every day saying, I need help, or someone who is in Colorado saying, is it safe for me to help someone who is coming to Colorado to help them access care? And the answer is yes. And there's a mistaken notion that those of us in these states where abortion is legal are doing okay, and we're really not. We are overwhelmed. We have providers and advocates and healthcare organizations standing here with me who are overwhelmed by the pace and the number of people that are asking for our help. The Dobbs v. Jackson Women's Health Organization Supreme Court decision overturning Roe v. Wade has had a profound impact on abortion access in Colorado. As one of the few regional access points for abortion seekers, Colorado's patient load has increased dramatically, as has the practical and mental health stress on providers and advocates alike. This is a strain on the entire system, and it's intentional. The trauma inflicted, not just on abortion seekers, but the people helping them, is the goal of the anti-abortion movement and those seeking to ban abortion nationally. And make no mistake, that is their intent. There are no unintended consequences to these bans. After the Dobbs decision, there's been a domino effect throughout the country, decreasing access not just to abortion care, but other types of reproductive health care as well, as has been mentioned. As clients from other states travel to Colorado for care, appointment availability is more limited, which causes people with time-sensitive health care to be delayed. This is true for abortion care and other reproductive health care. Providers all over the country have had to expand and look to new horizons to meet the increasing demand. Demand on our Cobalt Abortion Fund has exploded. It was originally helped to tide people over to pay for abortion care, especially those Coloradans who are discriminated against because they can't use their own state-provided insurance to pay for care. It was not designed to make up for half the states in the country banning abortion as a consequence of Roe being overturned. The Cobalt Abortion Fund has quadrupled its spending. We anticipate we're spending over $2.3 million this year at the rate we're going, 10 times what was spent pre-Roe. To say this is sustainable it's just not acceptable. We need a systems change, which is why this tour today is so important. And to just note that 85% of our practical support clients were from Texas in the first quarter of this year. We will not stop helping abortion seekers, but the strain we are under is real, which is why we look to allies like Representative DeGette and Secretary Becerra to do everything they can on the national level to help us here in Colorado. And with that, I would like to introduce my colleague and friend, Adrienne Manzanares, who is the CEO of Planned Parenthood of the Rocky Mountains.
Thank you. Thank you all so much for being here. While I'm the last speaker and I'll round us out, I invite you, everyone in the media, please spend a few moments to talk with our colleagues and friends behind us. We have a provider, we have community organizers. The stories are rich and deep and beyond my talking points, frankly. So I really hope that you all are able to stay and get the wonderful data and stories behind me. I do operate very proudly Planned Parenthood organizations, healthcare centers, and education programming here in Colorado, in New Mexico, in Southern Nevada, and in Wyoming. And in that time period, we have seen 15,000 people who've traveled for care since the Dobbs decision. And even before that, when Texas created a ban across abortion care and eliminated that care in September, the Senate Bill 8, we saw 3,000 people traveling in a very short amount of time. And I'm going to tell you the 3 things that I have learned in this process, and I want you to tell everyone you know. Number 1, abortion care is safe and it is common when it is a federal right, when it's legal for everyone. When the federal right is stripped and it goes down to the states, it is still common. The difference is that it is unsafe, it is dangerous, and the Congresswoman shared those terrible stories that we hear. The second thing I've learned is that the decision to make this healthcare choice in your life is deeply personal. It's a sacred decision between a medical provider, a faith leader, family members, and yes, some of us make it all on our own. It's our right to make this personal decision by ourselves, and it has no room in judicial systems, in elected officials trying to adjudicate whether or not abortion care should be legal. And we hear those stories over and over again about religious zealots, political maneuvering. Those decisions have real impacts in our community. I'll tell you the story of a couple who decided to seek an abortion. They lived in Texas. The 2 of them talked it through. They talked with a healthcare provider. They spoke with their own mother. They had a decision as a family, and they decided that they were going to plot out a 17-hour drive from Texas to Colorado. I want you to think about 17 hours in the car, first of all. So they plot this drive out, and they wrote it down on a piece of paper because neither one of them felt safe bringing their cell phones. They left their kids and their cell phones at home and drove 17 hours to our health center. That is not the United States of America. That is not who we are. That is the second point that I just want everyone to understand and know. These are family decisions, individual decisions, not meant for court systems and for the halls of Congress. And the third thing I want you to know, which is incredibly hopeful, especially this time of year, when people vote, we vote the right way. And we've seen this over and over again. And the story here for me, and I think about this a lot as my colleagues and friends are talking about how proud we are in Colorado. Colorado and Texas have a lot of similarities. And one of the similarities is that the public will, the public opinion of people who live in Texas and people who live in Colorado are the same. Abortion care is popular, it is wanted, it is seen as health care. The difference is that I get this lieutenant governor in Colorado. The difference is that I get Governor Polis. I get this woman to represent me in Congress. We have senators, my attorney general, my secretary of state. The difference is who gets elected in these states and who has power to speak on behalf of people. This is a critical time locally for the ballot initiative that's just been described, but absolutely federally. Everyone must get out and vote because I don't want anyone to have to hop in a pickup truck and drive 17 hours without their cell phones and their kiddos to get what is safe and common. Thank you all so much again for being here, and thank you for the secretary for making this wonderful trip. Yes, take good care.